What we call lens replacement surgery is an operation that replaces the natural lens with an artificial lens. Surgery is exactly the same as cataract surgery, and the lens is a little bit like the lens in your glasses. It corrects your short sight, your long sight, and even improves your reading vision. The procedure is performed in the clinic as an outpatient, so you won't be staying in hospital. Surgery takes about 10 to 20 minutes, depending on whether we're doing both eyes on the same day or one eye. And the surgery is done with a local anesthetic drop, so no injections to the eye. And if you're feeling nervous, you can have sedation, which relaxes you and makes you feel sleepy during the operation. Recovery from sedation is fast, and we'll usually keep you in the clinic for about 10 to 15 minutes after the operation. So total time with us on the day is about 1 to 2 hours. You then go home and start your recovery. Vision recovers very quickly within a day or two. Lens replacement surgery is based on cataract surgery, which is the most commonly done type of operation. It's very safe and predictable. And typically people having lens replacement surgery are patients who are in their late 40s, early 50s or older, who aren't suitable for laser surgery or want to have a solution that gives them good distance and reading vision.